you always want to strive toward perfection, but you don't want to get there, because if you get perfect, there's not much after that.
This is more about Dr. John Yadegar. He's the Chief of Surgery and Medical Director of the Metabolic and Bariatric Surgery Center at Palmdale Regional Medical Center.
I had actually started my education in Europe, in England, and I did my medical schooling at University College Hospital in London, and went on to do my residency at University College and subsequently at Adam Brooks Hospital in Cambridge, England. And after I decided to move to the United States, I continued doing the residency in Los Angeles at UCLA, and subsequently I went to New York Medical College and actually came back to UCLA for my fellowship because my interests were in minimally invasive surgical approaches, and I had a good exposure when I was doing the residency in New York, and I fell in love with patients who were having weight loss surgery laparoscopically, and that led me to my fellowship. And then, of course, after that, I went into private practice and never looked back.
Tell us how you got into this field. Why this specialty?
Now, it's a very interesting question because it's one of very few fields in medicine, I would honestly tell you, that is extremely gratifying. You have exposure to both genders, and you really see a diversity. And obesity, unfortunately, is a disease that knows no boundaries, and it's not a condition that respects race, ethnicity, or gender. It affects and afflicts a lot of people. And as a surgeon, really the joy that you see after you treat a patient that gets rid of a lot of their diseases is a huge buzz. So when you have someone who is riddled with multiple metabolic disease processes, diabetes, high blood pressure, cholesterol, sleep apnea, joint wear and tear, regular urinary problems, headaches, neurological issues, and then they go through a process of education and learning and dietary improvement and exercise, lifestyle change, and then they get their surgery, and now they have a complete different look of life. They're now no longer diabetic, they don't have high blood pressure, they don't have sleep apnea, all their metabolic problems have resolved, and they have much more energy and much more confidence. Their quality of life has improved. You have a completely set of criteria that has changed, and the person's life is altered, and their longevity has improved. And it's been a very impactful transformation. It really is a metamorphosis of a cocoon becoming a butterfly. And, when you follow these patients and you see that degree of change and how their lives has moved for the better, you can't, as a human, not just be in shock and awe and gratitude that you had a part in that, and it's a very humbling experience, and it's a sheer joy. And so for me, that was really the kick, that I just couldn't get that from any of the other things that I had exposure to as a physician. And once I felt that love for this subject, as I said, I never looked back. And so that is really the big part of this, is the big positive change that you see in the life of so many.
What do you do for fun, Dr. Yadegar? Tell us a little bit about your family and life outside of work.
Well, I love traveling, except I don't get as much time these days. But if I had more time, I would like to spend time just for kind of peace, to do some painting and music. I love listening to classical music. I picked up a guitar a few years ago, but I didn't pursue it, unfortunately, just because I didn't have time. But I'm hoping that's my goal, to get into the arts a little bit more and enjoy traveling a little bit more. And, of course, enjoy family and spending time with my loved ones.
Wrap it up for us. What else would you like us to know about Dr. John Yadegar and your philosophy of care?
Well, I would say when I look at my own life and I think to myself, what are the most important things I would wish to always have, and I thank God for, is good health and peace of mind.
This has been More About Dr. John Yadegar.